Klaus Schwab, it was only a year ago that we were in Davos, starting to hear about this new virus, this novel virus in Wuhan. No one at the time was really predicting we'd be here today.
The Johns Hopkins Center for Health Security, in partnership with the World Economic Forum and the Bill and Melinda Gates Foundation, hosted Event 201, a high-level pandemic exercise on October 18, 2019, in New York, New York. The exercise illustrated areas where public/private partnerships will be necessary during the response to a severe pandemic in order to diminish large-scale economic and societal consequences.
It began in healthy-looking pigs, months, perhaps years ago. A new coronavirus spread silently within herds. Gradually, farmers started getting sick. Infected people got a respiratory illness with symptoms ranging from mild flu-like signs to severe pneumonia. The sickest required intensive care. Many died. Experts agree, unless it is quickly controlled, it could lead to a severe pandemic, an outbreak that circles the globe and affects people everywhere.
So here's the policy crisis for this meeting of the board. How can governments, international businesses, international organizations ensure that reliable information is getting to the public and prevent highly damaging and false information, to the extent that's possible, about the pandemic from spreading and causing deepening crisis around the world? How much control of information should there be, and by whom? And how can false information be effectively challenged? And what if that false information is coming from companies or from governments?
So I think one of the ways that we need to approach this is to make sure that we have the right representatives on traditional media networks in order to portray our side of the story and make sure that there isn't misinformation. And so I think we really need to make sure, one, from a news perspective, that information is being disseminated correctly and that we have the right resources out there to provide this information.
Let's discuss now with Dr. Anthony Fauci, the Director of National Institute of Allergy and Infectious Disease.
And joining me now is Dr. Anthony Fauci. He's, of course, the Director of the National Institute of Allergy and Infectious Diseases. Right now, someone we've certainly bombarded with questions since almost day one of all this. Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases, and President Biden's Chief Medical Advisor.
Anthony Fauci, the nation's top infectious disease doctor, Chief Medical Advisor to President Biden, and the Director of the National Institute of Allergy and Infectious Diseases at the NIH. Dr. Fauci.
So I just pick up on the daily briefings, or twice daily briefings. During H1N1, WHO filled the parking lot in Geneva with the global press and provided them daily updates on what was happening. And I think that's a manifestation of flood.
And we do have, I think, a couple of strategies that are available to us, one of which is the flood strategy.
And deaths in the United States are now occurring among unvaccinated individuals.
99.5% of people who die of COVID are unvaccinated. Only 0.5% of those who die are vaccinated.
I would start by pursuing where trust exists in the ecosystem. Jane, in a prior meeting, mentioned that there's considerable trust by employees of their employer.
I also think that there is a good point in trusting in employees, in your employers.
There are a number of people, for one reason or other, who just do not want to comply and get vaccinated. We've got to get them vaccinated. And hopefully they will do it willingly. If not, there will have to be things that will essentially put pressure on them, such as you're not going to work in this particular agency or institution. You're not going to be able to go to this college or this university unless, in fact, you get vaccinated. And I believe that once we start doing that, you will see more and more people willingly get vaccinated.
The bottom line, we're going to protect vaccinated workers from unvaccinated coworkers.
But we also need to actually think about a technological answer to this. So there is work that's being done to actually create algorithms to sift through information on these kind of social media platforms. And I know that the Gates Foundation and others are funding organisations to work on things like this.
2 points. First is that we have to recognize that we are all susceptible to misinformation based on our beliefs and experience. And I think with the social media platforms, there's an opportunity to understand who it is that's susceptible in what form to misinformation. So I think there's an opportunity to collect data from that communication mechanism. The second thing is,
there are also proposed changes that we have made to social media platforms, including Facebook. And those specifically are 4 key steps. One, that they measure and publicly share the impact of misinformation on their platform. Facebook should provide publicly and transparently data on the reach of COVID vaccine misinformation, not just engagement, but the reach of the misinformation and the audience that it's reaching. That will help us ensure we're getting accurate information to people. This should be provided not just to researchers, but to the public, so that the public knows and understands what is accurate and inaccurate. Second, that we have proposed that they create a robust enforcement strategy that bridges their properties and provides transparency about the rules. So I think this was a question asked before, there's about 12 people who are producing 65% of anti-vaccine misinformation on social media platforms. All of them remain active on Facebook, despite some even being banned on other platforms, including Facebook, ones that Facebook owns. Third, it's important to take faster action against harmful posts. As you all know, information travels quite quickly on social media platforms. Sometimes it's not accurate, and Facebook needs to move more quickly to remove harmful, violative posts. Posts that will be within their policies for removal often remain up for days. That's too long. The information spreads too quickly. Finally, we have proposed they promote quality information sources in their feed algorithm. Facebook has repeatedly shown that they have the leverage to promote quality information. We've seen them effectively do this in their algorithm over low quality information, and they've chosen not to use it in this case, and that's certainly an area that would have an impact. So these.
Second thing is, with that ability, we can identify false information more quickly. We are actually receiving reports about people trying treatments that are purported to be effective but are actually harmful. And
I'm not totally sure what the president was referring to, but I believe he's referring to a report that used both hydroxychloroquine and azithromycin together to have some possibility of being in effect. Many of the things that you hear out there are what I had called anecdotal reports. They may be true, but they're anecdotal. So the only thing that I was saying is that if you really want to definitively know if something works, that you've got to do the kind of trial that you get the good information. The president is talking about hope for people, and it's not an unreasonable thing to hope for people. So when you have approved drugs that physicians have the option in a decision between the physician and the patient, are you going to use a drug that someone says from an anecdotal standpoint, not completely proven, but might have some effect? There are those who lean to the point of giving hope and saying, give that person the option of having access to that drug. And then you have the other group, which is my job.
Yeah, by now, we have more cases in China and also death cases reported. And also my staff told me before there's misinformation and there's some belief. People believe, this is a man-made, some pharmaceutical company made the virus. So there are some violations and even, death is because of this misinformation.
But Beijing acknowledges now that they don't think it originated in that market.
Well, it may not have originated in the market, but it certainly could have. I mean, I don't think that they admitted that it didn't originate in the market. I think they're saying they don't know how it originated. Yeah.
Well, there were clusters that may have been picked up and transmitted, as I understand it, through the market, but the place of origin was not within the market itself.
No, I don't think you could say that. I don't think you can say that. I think you could say we don't know how and where it originated. There are wet markets in Wuhan that are ample opportunity for a virus to jump from an animal that gets brought in from all parts of China that are very closely related physically to bat enclaves and caves and come to the market. So I don't think anyone can say that it didn't come from here or it did come from here.
Was said, but when we talk about our health, who do we typically trust? Our physician. And we're not talking about that right now. So, I mean, we need the physicians and the medical community really out there on the forefront talking about this.
So we really need to to train the health workers, especially health care workers, their access to the patients, to the public. So make sure they got the right information. So not necessarily, sometimes the healthcare workers, they know something, but if they are not well trained, they might give the wrong information.
And that's why it's particularly disturbing when you see healthcare providers, doctors, nurses, and others not getting vaccinated to the extent that you just mentioned. I mean, 20+%, 27% is a very, very high number for people who are involved in the healthcare profession, because they set the example for others. So that's one of the reasons why, when it came to hospitals that are associated and come under the rubric of Medicare and Medicaid, that people in those particular places have to get vaccinated.
The outcome of the CAPS pandemic in Event 201 was catastrophic. 65 million people died in the first 18 months. The outbreak was small at first and initially seemed controllable, but then it started spreading in densely crowded and impoverished neighborhoods of megacities. From that point on, the spread of the disease was explosive. Within 6 months, cases were occurring in nearly every country. The global economy was in a free fall. The GDP down 11%. Stock markets around the world plummeted between 20 and 40% and headed into a downward cycle of fear and low expectation. Businesses were not borrowing, banks were not lending. Everyone was just hoping to hunker down and weather the storm. Economists say the economic turmoil caused by such a pandemic will last for years, perhaps a decade. The societal impacts, the loss of faith in government, the distrust of news, and the breakdown of social cohesion could last even longer. We have to ask, did this need to be so bad? Are there things we could have done in the 5 to 10 years leading up to the pandemic that would have lessened the catastrophic consequences? We believe the answer is yes. So, are we, as a global community, now finally ready to do the hard work needed to prepare for the next pandemic?